Hello everyone, I'm Latricia Johnson, and the conceptual model that I chose is Becker's health belief model, which provides a framework for understanding why people engage in certain health-related behaviors, like following a treatment plan. It is based on how individuals perceive the seriousness of a health issue and the importance they place on taking steps to reduce that risk. The health belief model fits well with my former workplace in the emergency room because it explains and predicts why people do or do not take steps to stay healthy. So many patients who came into the ER were not following their treatment plans. They were non-compliant with treatments and medications. They didn't follow up with their primary care providers and sometimes waited too long to seek help, only coming back when their symptoms had gotten much worse. So this model looks at why and what people believe about their health. It includes whether they think they might get sick, how serious they think this illness could be, and whether they believe doing something like taking medications or changing habits will help. It also considers what might stop them from taking action, what things might remind or push them to act, and whether they feel confident that they can make the changes that they need to. This model also is used in health programs to help people take their medications properly, get vaccines, or live healthier lifestyles. For elderly patients who don't have help at home, we involve case managers to make sure that they get the support that they need. And we have access to these resources in the emergency room. So the four meta paradigms of nursing are person, environment, health, and nursing. So the person is the main focus. Every patient has different needs and are treated individually. The environment includes things like access to care and costs, which can be major barriers and might cause patients to delay seeking the help that they need. So when it comes to health, people take action because they want to stay well or get better. In terms of nursing, healthcare professionals should clearly explain care and treatments thoroughly and follow-ups. As nurses, it's our job to always encourage and support healthy behaviors. There are several reasons why the health belief model works well in an emergency room setting. The first is some patients may have a wake-up call during their ER visit that makes them realize how important it is to take better care of their health. The model also helps highlight common barriers people may face, like the high costs in the ER, lack of transportation, limited access to treatment, or trouble getting in to see their primary care doctors. Confidence in managing their own health or self-efficacy also plays a major role. Perceived susceptibility. Some patients don't think they're at risk for serious illness, so they ignore early warning signs until it gets worse, of course. Perceived severity. Others don't realize how serious their condition is, which leads them to getting delayed care. Perceived benefits. Some patients may not fully understand how sticking to their treatment plan or taking their medications can help prevent future visits to the ER. So two concepts from the health belief model could directly impact patient care in my previous workplace. And this includes like the teach back method, where the nurses relay the discharge instructions and have the patient explain it back to them. Another benefit is the discharge checklist that includes a short medication counseling session as well. And then for my work setting, we had a designated nurse who made calls after patients' visits a couple days later, just to make sure they're being compliant with their treatments as well. So in conclusion, the health belief model helps ER staff recognize and respond to the beliefs and obstacles that contribute to patients not following care plans, returning to the ER frequently, and experiencing poorer health outcomes. Becker's health belief model offers a framework for understanding why individuals choose to engage in specific health behaviors. Thank you.